Good afternoon, viewers all over the world. Good afternoon to everyone, and happy last Sunday of the month. So, how are we doing, and how has our Sunday been? So, you're welcome to the very first topic and presentation after our COVID-19 break. So, you're all welcome to our favorite show. Yes, you're welcome to our favorite show. On Sundays, Baker Health Foundation Life Talks, Baker House Life Talks, where we give health talks to our nursing mothers and pregnant mothers and our neonates. So today, I will be your host and your presenter, and I remain your humble presenter. My name is Nurse Anane. I'm a registered nurse and also the host of this program. So have been holding this program for weeks, or should I say close to a year now, where I give health talks to nursing mothers and pregnant mothers and our young mothers or upcoming mothers. Let me put it that way. So today, I'm very excited to be in your midst. I'm very glad to be in your midst, where I will be able to divulge a little topic due to popular demand. Though we've actually had this topic in the past, but a lot of people have been asking questions about it, so I decided to actually take it one more time. This is going to be the very last time we're going to take this topic. So if you really want to know more about this topic, our YouTube channel, the link is on our bio. Just go there, click on it, and you will get more videos on this particular topic. So today, while I wait for my viewers to join in, I'll just like to do a breakdown of what Baker Health Foundation is all about. Now, Baker Health Foundation is run by a group of nurses, whereby we come together to actually help the society in our own little way. I, on my own part, what I do is give live health topics, and I do live videos teaching people about health and wellness and promoting health and wellness in our young mothers, the pregnant mothers, and the nursing mothers. So basically, we've actually been involved in talking to only our nursing mothers and our pregnant mothers, because that's what our health foundation is all about, giving information to the young mothers. So other things we do aside that is going out for antenatal visits to healthcare centers and hospitals, whereby we give health talks to the mothers there, those that are not able to access us online here. We go there, give health talks to them, and then we also give them relief materials. Though we don't actually post such videos and such pictures on our page, because we are not doing that for publicity. We're only doing that to create awareness and also promote health wellness amongst our pregnant mothers and our nursing mothers. So I won't take much of our time today, because I know a lot of us have actually been through a lot during this COVID-19 period, and we've actually been on break from these health talks and health promotion techniques because of the period. And we know that everyone, okay, fine, I don't have money to sub, I don't have money for data, so we are now making it easier for us. So what we all do is, even if you can't make it to our live talks, our live videos, all you just have to do is go to the link in our bio, click on it to take you to our YouTube channel, subscribe, and please download the videos. If you can't download them, just watch them and get to know more about what we're talking about. Also, we have some of our videos that are posted on our Instagram page here, just to encourage us to go for the full video so that we can actually learn a lot. And please don't forget to involve your nursing mothers. If you have a sister that is pregnant, you have a cousin that is pregnant, that is expecting, please try to involve them in our videos, because they are actually helpful tips that can help them to take care of their young ones when they are born. So running into this topic, I will be talking on neonatal jaundice. So what's neonatal jaundice? Everybody has actually been concerned about it. A lot of mothers out there, they have issues with jaundice. You see them complaining, why is that my baby come down with jaundice? I've heard that a lot of babies die from jaundice. So today we actually going to talk about jaundice. We're going to give us much information that we need to know. So first and foremost, I would like to say jaundice is a clinical term just used to describe the yellowness and the discoloration of the skin and the sclera of the eyes of a newborn. I'm just going to use layman language because I'm not going to be using clinical terms and clinical instructions, because I would like us to actually understand the topic. So I will just say it's a yellowish discoloration of the skin, the membranes, and the sclera of the eye. When I mean the sclera of the eye, the white part of the eyes. This is the white part that you can see in my eyes. Yes, there's a yellowish discoloration of it. That's when you can say a young child has jaundice. So when we talked about yellowness and yellowish discoloration of the skin and the sclera of the white part of the eye in neonates, who are the neonates? Now the neonates are the newborns that are just, let me say, young ones that are just giving birth to, and they've not passed or exceeded the 28 days. So they are within the range of 0 to 28 days. Those are the ones we call the neonates, or we call them the newborns, or we call them the young ones. So now neonatal jaundice affects neonates more due to some specific reason. One, there is increased destruction of their red blood cells when they are born. Now, in a situation whereby a newborn baby is born and then the cord is cut off, that is, there's a separation between the baby and the mother after delivery due to the cutting of the umbilical cord. Immediately that happens, the red blood cells in that baby is unable to stay up to 120 days. Normally our red blood cells in our body as adults is supposed to last for 120 days, but in young children it is not like that. Their red blood cells can only last 60 days. And when there is destruction of these red blood cells, when these red blood cells break down or they die, they produce a lot of things such as bilirubin. Now, bilirubin is a main component of the destruction of red blood cells. Now, a baby that is born newly does not have a matured liver. The liver and some of the organs in the body are not yet fully matured for it to be able to process or do the life processes that a baby is supposed to do, especially the liver and the lungs. The lungs are not fully formed. That is why they will always advise young mothers or new mothers not to expose their babies to adverse weather conditions, because the lungs are not strong enough to be able to compact or fight against cold weathers and other harsh weathers. That's why they will tell you, okay, don't expose your baby to too much cold, don't expose your baby to too much heat and all that. Now it's the same thing in the liver. The liver is not well formed yet, and it doesn't have the capacity to break down this bilirubin. Now this bilirubin is normal for the body, because even it's found in our urine, it's found in our feces. Now in our feces for the adults, it's called urobilirubin. That is where it is being excreted. Now, when there is a breakdown of food, there's a breakdown of red blood cells. This bilirubin is being produced. Now, the work of the liver is supposed to filter this bilirubin and take it out of the body. But now, the liver of the baby is not yet fully formed. It's not yet fully matured. And when there is rapid destruction of these red blood cells, the bilirubin production increases, which makes it creates an inability for the baby to be able to break down this bilirubin. That is why you notice that baby will start having this yellowish discoloration. So to me, I used to tell my mothers at work, because I work in a pediatric unit, I used to advise them, don't panic. Jaundice is normal in every young child, and it's more prevalent in the premature babies. That is a baby that is born before 37 weeks of life. Now, a baby is supposed to grow in the womb up to 37 or 40 weeks of life. But when a baby is born before the 37, maybe 35 or 33 or 32 weeks of life, that baby is considered a premature baby. Now, in a situation like that, it is always normal for that baby to definitely tend to come down with jaundice, because a lot of organs that were supposed to be developed during pregnancy has not developed yet before the baby was born. So I used to calm down my mothers, please don't worry, your baby is going to be fine. Jaundice is normal because your baby's liver is not yet matured enough to filter out this bilirubin. That is one of the causes. So this is increased destruction of red blood cells. That's one of the causes. Another cause is if there's excess bleeding, hemorrhage in the body. Now, when a baby is born and the cord is cut and it's not well clamped, the baby can bleed to the point from that umbilical cord, and bleed to the point that the red blood cells that is supposed to help the baby to retain its normal color will break down in large quantities. Why? Because the baby is bleeding, and when there's an active bleeding, the red blood cells will break down so that it can produce plasma and other things that will actually coagulate and stop the bleeding. It's just an active form of the body. The way the body responds to bleeding, the body will want to create plasma proteins and everything that will actually clot and stop the bleeding, that active bleeding at that point in time. And when there's such things happen, there's rapid destruction of red blood cells too in that process, thereby increasing the level of bile in the baby's body. Another cause is infection. When there's an infection in the baby's body, either viral or bacterial, it is called neonatal sepsis. That is infection of the newborn. When infection is noticed in the body, it tends to break down the body's antibodies. The baby does not actually have enough antibodies for now. So the antibodies are not even enough to fight the infection, talk less of to break down the bilirubin. So it helps to just weaken the immunity of the baby and then increases the bile content of the baby. So most of the time, when a baby is brought into the hospital with such kind of condition, yellowness of the skin and the sclera of the eye, the first test that a doctor will recommend for you is for you to go through a white blood cell count to know the level of infection in the baby's body. Now, the level of differentials, the differentials that we're going to get is what is going to make us to know whether the baby has sepsis, which is called infection, or not. Another cause is incompatibility between a mother's blood and the baby's blood. Now, there's a process whereby the mother's blood and the baby's blood are not compatible. So the baby is going to develop antibodies against the mother's blood just to fight, because normally our body is created in such a way that anything that is foreign material that gets into the body tries to create a medium to fight it. Even if that thing is not harmful, it just has that tendency, that mechanism of response has been created in the brain already, that anything that is not for this body, immediately it enters the body has to create antibodies against it. So that is why when a mother and a baby's blood is not compatible, you will notice the baby would create antibodies, and that antibody will start to fight the blood. And when the antibody starts to fight the blood of the baby, there's also active destruction of red blood cells, which also will lead to the increased bilirubin, like I explained earlier. Another cause is a deficiency of an enzyme. Very, very important. A lot of our mothers don't know about this part though it's actually medical, but we need to actually bring it to light for mothers to know. There is a test called G6PD. It's called glucose phosphate 6 deficiency. So now, if this is an enzyme that is normally supposed to be in the body, now there are some babies that are born without it. Yes, there are some babies that are born without it. Now, this enzyme helps to rejuvenate the body and also helps in the production of red blood cells. It increases the production of red blood cells are cells that are needed in the body for the product, just like normal blood cells, because we have different blood cells. We have white blood cells, red blood cells, and we have the plasma, we have the platelets. So now these red blood cells can only be produced when you have this enzyme in the body. Now, there are some babies that are born without it. Why? It's genetic in nature. That has never been, the cause has not been explained, or should I say founded, why it is that way. But it's just a genetic disorder. A baby will be born without the enzyme, and when a baby is born without that enzyme that is supposed to be produce red blood cells. Now, when there's this active destruction of the red blood cell when the baby is born, and this enzyme is not there to produce another one, the baby definitely does not have enough red blood cells. And then instead of having enough red blood cells, the baby will be having enough bilirubin in the body, excess of it. Now, most of the time, this kind of babies will come down with acute bilirubin encephalopathy, because the bilirubin level gets to a point whereby it's very high, And if the mothers are not careful enough to notice it on time, it gets to the brain and affect a lot of things. So most of the time, these babies that come down with it, the first test they ask them to do, they will tell them to go and do a GC test to be sure if the baby actually has the enzyme or not. If the baby doesn't have the enzyme, they will know what next to do. Now, those are the causes. Like I said, the active destruction of red blood cells, the first cause. The second one is hemorrhage. The third one is infection during the first 28 days of life, also known as sepsis. The third one is incompatibility. Incompatibility between the mother's blood and the baby's blood. And the fifth one is the deficiency of an enzyme called G6PD. So those are the causes of neonatal jaundice. So I would quickly go to the signs and symptoms. So what are the signs and symptoms? Now, I'm going to talk about this depending on the severity of the condition. Now, when it's between the mild and moderate period, you notice just the yellowness of the eyes, the yellowness of the skin of the baby. The baby will have a dry skin. How do you know when a baby has a dry skin? When you pull the skin does not return to its original shape and size. There's no skin to go. The baby looks dehydrated, and the baby would have loss of appetite. The baby might not be able to suck well. So during this condition, that's the mild to moderate signs and symptoms of neonatal jaundice. So mothers are actually advised to make sure they breastfeed their babies well. That is why I always say that breastfeeding comes first in anything. Like my mothers at work, I used to advise them, I will encourage them, please make sure you are doing your baby friendly. And what is called a baby friendly? Breastfeeding all the time. Most of the time, I do advise that don't relent on this our treatment for this jaundice. As long as you're able to breastfeed your baby well, you can fight jaundice. That is just it. Because the breast milk contains active minerals and nutrients that are needed for the baby to build antibodies against this bilirubin. And these antibodies that are needed can even help to actively increase and help to make the liver to mature so very fast that it can start its works at its normal pace. So I always advise that you actually breastfeed. And for those that cannot breastfeed, such as like our exposed mothers that can't breastfeed their babies and they want to use the infant feed, we always advise that you always feed regularly with a range of 30 to 60 meals of feed every 2 to 3 hours daily. Every 2 to 3 hours, make sure your baby is eating if you're using an infant formula. And if you're breastfeeding, I used to advise on 1 hour self. Every 1 hour, just breastfeed your baby because the baby needs that breast milk at that point in time. Now, going to the acute bilirubin encephalopathy. The encephalopathy meaning that the brain is already involved in this neonatal jaundice. The brain is already involved. It has affected the brain, it has gotten to the brain, and the value of even the value of the bilirubin level is even more than, because the normal value ranges from 2 to 0.5 milligram per deciliter. Now this one is even more than 2, is even more than 10. You will be seeing a value of 40.5 milligram per deciliter for a newborn, and you'll be shocked. You'll be saying 40.5, you'll be saying 50.5, 60.5. That is what we call acute bilirubin encephalopathy. The baby is already kernicterus. When I mean kernicterus, that is the brain cells are already affected with the jaundice. What are the signs and symptoms that you notice in such kind of babies? So that if you have one beside you, you can actually advise them to take the baby to the hospital as fast and as possible as they can, so that they can save the baby's brain from degenerating. So now the first sign you will notice in that baby is general yellowness of the body. The baby will be as yellow as anything you can compare it to. Even a layman that doesn't really know anything about neonatal jaundice, or I've never seen a baby that has it once, would notice that yellowness, and the person will be like, wow, this baby is yellow, abnormally yellow. That is it. That's the first sign. And the second sign is fainting, difficulty in waking up. The baby would want to sleep for a long time. Even when you try to rouse the baby that, oh, baby, stop sleeping, wake up and eat, the baby will find it difficult to wake up. the brain cells has already been affected. Then another sign you will notice is listlessness. What did I mean by listlessness? Like listlessness. What do I mean by that? Now, a baby is weak, unable to move the body. You just notice the baby is sleeping, you're trying to rouse the baby is not responding, and then the baby is feeling as if he's in pain all over the body, unable to respond to movements, unable to respond to things that are going on. Even when you try to apply pain threshold, pain pressure on the baby is not responding to the pain. The baby is just listless like that. Those are the signs of acute bilirubin encephalopathy. Another sign is the aching of the back and the neck. You notice the baby, when the baby lies down, the baby will prefer to ache the neck. You hack the neck to the back like this, and then you'll be wondering, why is this baby not sleeping well? You want to turn the baby. If you try to turn the baby will scream, because it's comfortable that way, because of the brain cells that is attached to the spinal cord has already been affected with the jaundice. So the baby is comfortable that way. You will not want to turn or sit straight like this. You will always want to arc the neck and the back while sleeping. Another sign of it is high-pitched cry. There are different levels of cry. I know I really need to talk about this with my mothers, but this will not be treated today. Maybe next Sunday I'll talk about the different kinds of cry that a mother should expect in a newborn. Now, there's what we call high-pitched cry. High-pitched cry is something like when you hear a baby crying so thinly, as if it's a cat that is crying beside you. That kind of cry that is so thin that's as if it's coming from the oropharynx itself. That's what we call the high-pitched cry. And it's very thin and very loud. When a baby cries like that, you know that the brain cells that are regulating the response to stimulus has already been affected. That is why that baby is having high-pitched cry due to neonatal jaundice. So those are the signs and symptoms of acute bilirubin encephalopathy. I mentioned listlessness of the baby, high-pitched cry, loss of appetite, poor sucking. The baby will not want to suck well. Then the baby will have difficulty in waking up. Even if you try to rouse the baby up, that okay, stop sleeping, the baby will have difficulty in raising up. And then there's the backward aching of the neck and the back. And then the last but not the least, that is very prominent, is the fever. The baby will have a very high temperature. No matter how much you try to bring the temperature down, it will never come down, because this brain cells that is regulating the thermoregulator in the brain cells has already been damaged by the high level of the bilirubin in the body. So the baby will be having continuous fever for a very long time. So now let's rush to the treatment. Now, the only treatment I advise, firstly, like I said earlier, I used to encourage my mothers that please try and breastfeed your baby very often. Breastfeeding is my personal way of encouraging mothers to treat their babies with, and it has actually been yielding a lot of good results. Although there are some times that some breast milk does not have enough nutrients that you need, but even at that, we still encourage them to try them more. There are some mothers that when they give birth, they will say, my breast is not producing milk. No, we don't take that. I personally try to help them to produce a lot of milk by encouraging them and assisting them on how to actually squeeze the breast and actually how to massage the breast so that they can produce more breast milk. Because breastfeeding is actually, it has shown a lot of signs of helping children out of neonatal jaundice, and it's still the leading way of helping children. Another way of treatment is through phototherapy. Like I said, this one is mainly for mild to moderate neonatal jaundice. Phototherapy, the baby is put under a blue-green spectrum of light. So the light is able to alter the shape of the bilirubin in the blood cells in the body, thereby counteracting it and killing it in the process. So that's phototherapy for you. The baby is placed under a blue-green spectrum of light. So the light radiates on the body and changes or alters the shape and the molecule of the bile in the body, thereby killing it in the process. Then another treatment for the acute bilirubin encephalopathy, when the baby has gotten to a level whereby if there's connectorus, there's listlessness, there's poor sucking and appetite. When a baby gets to that point, what we do is exchange blood transfusion, because I told you earlier that the value of bilirubin level in that kind of baby will come out to be 40.5 of 50.5 thereabouts milligram per deciliter. So when a baby comes with that kind of value, what we do is exchange blood transfusion, whereby we try to withdraw small amounts of blood from the baby's body, and then we put in a new donor, a fresh donor's blood. It's transfused back into the baby's body, thereby trying to create more of the red blood cells that is going to create more antibodies to fight the bilirubin. So that is that about neonatal jaundice today. I know we all have questions and answers, but I don't really have much time for us to ask our questions. But I promise that you can also drop your questions on our page. You can drop your questions and we will treat them before we start our next topic for next week. So for everyone that joined us today, don't forget what I said about neonatal jaundice, and please, if you were able to gain something, try to tell someone beside you, try to tell a pregnant mother beside you, and teach her. And if you know you cannot teach her the way you've been taught here, you can actually go to our YouTube channel. The link is on our about here on this same page. Just click on it, you will see the videos there, watch them, and you can use it to teach the pregnant mother or the nursing mother. There are a lot of mothers out there that are scared of coming to the hospital because of jaundice. Fine, jaundice is safe when it's still in the mild to moderate period. So it's always advised that when mothers notice this yellowness, or if you notice your baby's skin changing color suddenly, please try and visit the nearest health center or the nearest hospital to know what is really going on. There are some mothers that will just sit at home and say, my baby is getting fair. No, your baby is not getting fair. There are some babies that are not born to be fair. When you notice that when your baby was born, he was not as fair as this, and then you notice that the skin color has suddenly changed in 2 to 3 days, please visit the hospital to know what is really happening. We can never be careful with this, our newborns, and if we really want to take care of them and make sure they grow up to be the futures of tomorrow, we really need to take care of their today, of their first 28 days of life. The first 28 days of life of a newborn is very, very critical. So we don't like to take it for granted. So as for those of you that joined today, I'm sure you've learned one thing or two about neonatal jaundice, and I really appreciate your presence. I appreciate your time. Those that could not even wait for us to end, well, as long as you were able to gain something, please try and teach someone beside you something and be a solution out there. So thank you once again for joining in on today's Becker Health Talks, brought to you by Becker Health Foundation, where we keep you informed, not to be deformed. I remain your humble host, Nurse Anane, a registered nurse and also a pediatric nurse. Thank you and God bless you. Have a blessed evening. Thank you.